I'm Dr. Jim Grant from Colorado Springs, Colorado, and today we're going to interview one of my patients who has had a dental implant placed, and I'm just going to ask her a few questions and see how she's doing with her implant and get her input on some of this. And I'll step over to the side. So where is your dental implant located?
Well, I happen to know it's tooth number 14. It's in my upper left part of my mouth.
That's right, that's true. We'll show a picture of that in just a little minute here. And how long have you had the implant and the crown? And others, from start to finish, from the time you got the tooth extracted till the restoration, how long has that been?
It's been about a year and a half. I think the tooth was extracted in March of 2010.
About a year and a half then. All right. In your own words, how often do you floss and brush, water pick, whatever you do?
I've always been an everyday flosser and have a Sonicare toothbrush. Always taken really good care of my teeth.
And now with this implant on number 14, do you find it any more trouble now that you have this posterior implant?
Oh yeah. It's a food trap, and it constantly has my attention.
What do you mean it constantly has your attention? Tell me more.
Anytime I eat. Anytime I eat, it has my attention.
Okay. All right. And for just a second, I'm going to have you take a picture. We'll show the implant on the screen here. If you can just move over and just show that. And so we can see what we're talking about. That is the X-ray of the restored implant. It's done very well. The surgeon placed it well, and that is standard of care for dental implants. I understand you're catching more food around it, but are you surprised at that or disappointed that now you seem to be trapping more food around there?
Yeah, I'm sure somebody told me along the way that I'd have food trapped in my teeth, or that I might get more food trapped around the tooth. But I'm really surprised at the quantity and that it's a bit of an issue. And for the first few months, I was in and out of doctor's offices with infections and was concerned that it was going to be like this chronic type problem.
Do you have a Sonicare toothbrush?
I do.
So the Sonicare wasn't able to keep up with it?
I was using floss and toothpicks, and I almost feel like I was making the situation worse. Maybe I was pushing the food up too high, and that maybe things hadn't quite healed enough, and that maybe that was what caused the infection.
Now, you're saying there was an infection. This is not just an irritation from having food and bacteria trapped in there. You felt like there was actually an infection around?
Oh, there was. There was a pustule, there was a drainage. I went back to the oral surgeon. I went to see an endodontic specialist to see if the other teeth around the implant were affected. The other teeth are fine, and the endodontist said that if the infection didn't clear up, that he'd suggest I go see an ear, nose, and throat person. During the course of the day, I carry dental floss, I carry toothpicks, I take care of whatever food's in there with that, and then at the end of the day or first thing in the morning, whatever, I do a good water picking.
Were you instructed before the implant that this could be a consequence, or were you prepared for this much extra cleaning of your teeth around the implant? Was this a surprise, or did you expect?
Yeah, it was a surprise. In fact, we had talked about a bridge versus an implant. And I think I thought that an implant was just going to be like having my tooth back. And well, like I said before, maybe somebody said that I might get some food caught around the implant, but I was definitely surprised at the quantity. For me, it's been a real food trap, and I didn't know what that meant because I never had a fake tooth before, so I never experienced food traps.
Well, let me ask you this then. If there was an alternative to this, and this is indeed standard of care and it's well done, your implant, so if there was an alternative to a treatment that would prevent or lessen the spaces in between your teeth, And I don't know if it would completely eliminate food getting caught in there, but let's say it's substantially limited how much food you got in there every time you eat. Would you be interested in a treatment like that?
Yeah. I mean, yeah, of course. I mean, that's like a no-brainer. Yes, I would love the implant that would keep this from happening. Absolutely.
Give me an idea of how much you paid. I know you have insurance as well, but what the cost was for this.
I think it was about $3,500.
$3,500. Well, let's say that for another $200 or so extra for this alternative treatment, which there really isn't yet, but if there was one available, then it cost you a couple hundred, $200-300 extra, and you wouldn't have this experience with the food, or certainly have less food in there. Would you be willing to pay that extra for that?
Yes. I mean, the answer is just obviously yes. And anybody, if I were in your shoes, anybody that was going to get an implant, I'd say, you need to spend this extra money. Knowing what I know now, I would love an implant that negated some of these problems that I'm having. And maybe it wouldn't make it go away altogether. I mean, I don't know, but anything less would be worth the few, a couple $100 more for something superior.
Okay, all right. Well, I want to thank you for being so honest, and thank you for taking your time. And let me just come over here and just say, this is Dr. Grant, and thank you for watching this. And if you have any questions, you can visit my website or email me. And thanks again to my patient.
You can email Dr. Grant at grntjcg@aol.com.